Hypothyroidism, a condition where your thyroid gland doesn't produce enough thyroid hormone, can be a challenging health issue to manage. Your diet plays a significant role in this process, as certain foods can either support or hinder your thyroid function and the effectiveness of replacement hormones if you're undergoing thyroid treatment. You're watching the InfoIndex, where learning never stops. Let's get started. Before we delve into the foods to avoid, let's briefly understand hypothyroidism. According to the American Thyroid Association, over 12% of the population may experience thyroid-related conditions at some point in their lives, with many individuals unaware of their condition. While factors like genetics and environmental influences contribute to hypothyroidism, your dietary choices are within your control and can significantly impact your well-being. While there's no magic hypothyroidism diet, making informed choices about what you eat can help you feel better. Here are 9 foods you should consider limiting or avoiding. 1. Foods with soy. Soy, including edamame, tofu, and miso, has long been a topic of concern due to isoflavones potentially affecting the thyroid. While recent research suggests that soy has minimal impact on thyroid hormones, it may interfere with thyroid medication absorption. To be safe, wait at least 4 hours after consuming soy-based foods before taking your thyroid medication. 2. Cruciferous vegetables. Cruciferous vegetables like broccoli, cabbage, and cauliflower are rich in nutrients but could interfere with thyroid hormone production if you have an iodine deficiency. However, consuming a significant amount of these vegetables is necessary to impact iodine uptake. Cooking them can reduce their effect on the thyroid gland, and limiting your intake to 5 ounces a day should not adversely affect thyroid function. 3. Gluten. Gluten, found in foods processed from wheat, barley, rye, and other grains, may irritate the small intestine and hinder thyroid hormone absorption, especially if you have celiac disease. While research doesn't confirm that a gluten-free diet treats thyroid conditions, it may be worth discussing with your doctor if you have both hypothyroidism and celiac disease. 4. Fatty foods. Fats, particularly from sources like butter, meat, and fried foods, can disrupt the absorption of thyroid hormone replacement medications. Reducing your intake of fried foods and fatty cuts of meat is advisable to maintain effective thyroid treatment. 5. Sugary foods. Hypothyroidism can slow down your metabolism, making it easier to gain weight. Avoid foods high in sugar, as they are calorie-dense and lack essential nutrients. Reducing sugar intake or eliminating it from your diet can help you manage your weight effectively. 6. Processed foods. Processed foods are often high in sodium, which should be limited by individuals with hypothyroidism to manage their increased risk of high blood pressure. Check nutrition labels for low-sodium options, especially if you're at risk for hypertension. 7. Excess fiber. While fiber is beneficial, excessive consumption from beans, legumes, and vegetables can complicate hypothyroidism treatment by interfering with the absorption of thyroid medication. Consult your doctor if you're on a high-fiber diet to determine if your medication dosage needs adjustment. 8. Coffee. Caffeine can hinder the absorption of thyroid hormone replacement. It's essential to wait at least 30 minutes after taking your medication before enjoying your morning coffee to ensure your thyroid treatment remains effective. 9. Alcohol. Alcohol consumption can disrupt thyroid hormone levels and the thyroid's ability to produce hormone. Ideally, people with hypothyroidism should either abstain from alcohol or consume it in moderation. Managing hypothyroidism through diet involves making informed choices to support your thyroid health. While there's no one-size-fits-all solution, being mindful of these foods and discussing dietary adjustments with your healthcare provider can help you lead a healthier life while managing hypothyroidism effectively. Thank you for joining us on the InfoIndex. Feel free to share your personal thoughts in the comments section below. Make sure to like, subscribe and hit that bell icon so you don't miss out on new learnings.